Ladies and gentlemen, the European Union has set itself an objective that is very ambitious. Not only to provide a better quality of life for cancer patients, survivors and their families by 2030, but to beat cancer by 2030. Obviously, it is not realistic to think that we will completely defeat, that is, rule out cancer by 2030, and we know why. Our European population is aging, partly thanks to progress in medical care, not least in the field of oncology, and as you all know, cancer is very often an age-related disease. But this observation also underscores the urgency to address this pathology through a concerted and encompassing effort. Yes, we have made important progress in recent decades in understanding cancer, in its diagnosis and treatment, as well as in the early detection and even prevention of this pathology. Consider, as a prime example, the major impact the introduction of immunotherapies and CAR T cells had on the treatment and survival of cancer patients. Also, revolutionary advances in profiling the genomic variations in tumors through next-generation sequencing at an affordable cost for healthcare systems has created new options for patients with advanced cancers. And Belgium has done pioneering work in implementing these novel diagnostics in routine care over the years. In order to reinforce these efforts, I fully support the Belgian Cancer Research Alliance, which brings together, on a voluntary basis, key Belgian research institutions in the field of cancer to streamline and facilitate the transition from research to the patient, that is the so-called bench-to-bed approach. However, the introduction of all these innovations into healthcare systems also requires careful consideration and monitoring. They may, perhaps involuntarily, create significant budgetary pressure on national healthcare systems. Also in this regard, scientific research is so important. Frequently, we lack knowledge with a sufficient degree of certainty on the real clinical utility and cost-effectiveness of innovations, while we are already asked to decide on reimbursement. Often, we simply lack the data. And the word is there, data. Yes, we need more data demonstrating that certain innovations provide real benefit to patients or citizens, whether they are medical or public health interventions. Therefore, it is imperative to strengthen and also reconsider current practices with regard to data generation and use, including health data generation and use. The arrival of AI applications at an unprecedented speed also forces us to act promptly. I'm therefore curious to see how the UNCAN consortium plans to develop their data platform for cancer research, but I'm deeply convinced that this platform can become a very important instrument to achieve Europe's ambitions. However, it is essential that the cancer data platform is interoperable and perhaps even better, integrated into the other data space initiatives we are launching at the European level. The European health data space in particular, but also the infrastructures for genomic data and images are crucial partner initiatives indeed. Simultaneously, we ought not to forget that health data is about people. Hence, we should handle such data in a safe, a respectful and a fair manner at all times for the benefit of all individuals in our societies. But I know that this is your commitment. Let me therefore conclude by saying that I am truly optimistic that Europe can collectively take a major step forward in the fight against cancer over the next 10 years. In that spirit, I wish you an interesting and a productive final conference. Thank you very much.